Hi guys, welcome back to my channel. How have you been? It's been a long time. Yes. How are you doing? Are you okay? Are you feeling great today? Welcome. Welcome back to Talks with Baby. If you've not already met this person, I'm your favorite host, the baby girl of this channel, Favor Idede. Welcome. Today we have something really interesting, something I know you'd like, you'd love, something I know you'd learn from. Yes, because this is a really educative topic. Yes, this discussion is really educative and you'd like this. You need to know this. Even as youth of today, you need to know this. You understand me? Both old, young, you need to know these things we'll be talking about today. So today we'll be talking about blood pressure. We'll be talking about high blood pressure. We'll be explaining it in details. We'll be discussing the signs, the symptoms, and how it can affect individuals. We'll also be talking about how it can be managed. So you see, today's topic is a very broad one, as you can see, and it's going to be a whole ride because you're going to enjoy every bit of it. This is my guest to be breaking this gist for you small by small. Do you understand? And you're going to love it. I'm telling you, you are going to love it. So just sit back, relax, grab your popcorns, and let's do this.
Hello everyone, my name is Dr. Shalom and I'm a medical officer in Abuja, Nigeria. I'd like to talk very briefly about high blood pressure. High blood pressure is a big problem in our society, in the nation, all over, and there used to be a time where it was tagged to have a particular age group, but now we are seeing a trend where even people who are much younger than 30 years are having high blood pressure. So this truly is a big problem, and I'm hoping that at the end of this video you have more information about what high blood pressure is, how to prevent yourself from having it, and if you already have it, what to do. So for us to get to understand what high blood pressure is, we need to understand what blood pressure is in the first place. Blood pressure is that force that pushes blood through a system, what we call the arteries, allowing every tissue to be able to have adequate amount of blood. And the blood carries oxygen, the blood also carries nutrients that allows every cell to survive and function effectively. The body has what we call the circulatory system, with the heart being a central part of it. It gets to pump blood to all the tissues through the arteries, and it receives the blood back from the tissues through the veins. It is important that a pressure gradient is followed consistently through all the vessels. Why? Because from the heart is the biggest artery. The diameter of the artery that takes blood from the heart is the biggest. And as it goes through all the parts of the system, going to the shoulders, to the neck, down to the hands, even to your fingers, it reduces in size. So that fluid that needs to pass through each diameter needs to have a constant pressure so it can push itself, it can force itself through those vessels and be able to reach every tissue in adequate supply. Now, what happens with high blood pressure is that consistent flow becomes consistently high, higher than it's supposed to have for every tissue. And then if it continues over a period of time, it becomes problematic to every cell. It's either number one, the cells begin to die off, or number two, their functionality is impaired. So why is high blood pressure a problem, you may ask? Because if over time the cells are not able to use the blood that's received, they begin to die off. And once they begin to die off, then you know that that organ containing all of those cells is in trouble. Once organs start failing, then the entire system is in trouble. So that's why it is very important that the blood is maintained through a pressure gradient that's supplied by the heart in combination with the force that we call the peripheral pressure from the cells and the tissues. There are always two values you get. There's one, it's kind of like a fraction, so there's one on top and one below. The one on top is called the systolic pressure, and the one below is the diastolic pressure. I don't want to bore you with all the details of what that means, but so there's always the systolic pressure and the diastolic pressure. So before we talk about high blood pressure, we want to talk about what normal blood pressure is. So the normal blood pressure is considered to be anything lower than 120 millimeters mercury systolic pressure and 80 millimeters mercury as diastolic pressure. So that's 120 over 80. Anything lower than that is considered to be normal. Anything above 120 over 80 is considered elevated blood pressure. Now, there are stages and classifications to what that elevated blood pressure is. Why is high blood pressure a problem? Well, first thing is when it comes to high blood pressure or hypertension, there typically are no symptoms in the beginning, and that's why it's considered a silent killer. Like I explained in the beginning, that the blood pressure continues over a long period of time to the point where the blood vessels are no longer able to contain that pressure. Then it begins to affect the tissues, and as the tissues begin to die off and begin to struggle in their functions, the organ then begins to struggle. So it's a long period of time from the first insult to the tissue to the point where symptoms begin to manifest, because the body has its own system of trying to, what we call, compensate that condition. So for someone to actually have high blood pressure, they may not even know. But the time they start having symptoms, then you know that the organs are already in trouble. What organs can get in trouble? The liver, the kidneys, the heart, the brain, every part of a person's system that receives blood can be in trouble when the blood pressure is sustainably high over a long period of time. So the person may not even have symptoms. The person may just be going on with their own their own life and everything. And for someone typically who doesn't check their blood pressures, may not even know. Could be walking and all of a sudden just slump and the person is dead. Or someone could, get overly stressed at work and right there just fall off and they're dead. This is what high blood pressure can do to a person. Now, there used to be a time where it was considered a high blood pressure was considered an old people's disease. But sadly, we are in a generation where young people, even up to the age of 19, 20, are having high blood pressure. So truly, there is a problem. And this is what we want to help. This is what we want to educate people to know. It's not going to the hospital that's the problem. It's not getting a diagnosis that's the problem. It's actually doing everything that you can to help your own body, to help your own system. Because if you can find it early, believe me, you can handle it. People would be asking is, okay, so how do I know that I have high blood pressure? Well, simple. Just go to the hospital, go to a clinic, and have your blood pressure checked. First is, remember, there are no symptoms, obvious symptoms that you would pick immediately, unless it has gotten to the point that there is, organ damage, or the tissues are already in trouble, different parts of the body are in trouble already. So it is important that you do regular blood pressure checks. There are different devices that are used, and I'm sure you already have an idea. There are the aneroid, the mercury, the digital sphygmomanometers that are attached to the body, and then they just inflate some pressure from the outside and are able to tell how much pressure is within the blood vessel. Yeah, so an example here is this one. This one is the mercury sphygmomanometer, and that helps to check the blood pressure. So it just takes less than 5 minutes for you to check your blood pressure. Some places you have it done free, some places you may pay a little bit, just a little token, just to have your blood pressure checked. I advise and I encourage you to check your blood pressure. If you are in the risk category, please do at least one first, and then you would know the level of your risk. For example, if someone has gone to check their blood pressure and they were told that their blood pressure is 130 over 80, okay, yeah, you would be like, okay, yeah, it's not too bad. But for me, that's not good, especially depending on your age. And like I said, there are so many factors that need to be considered. So there's no one size fits all. Someone's blood pressure could be 130 over 80, and another person's blood pressure could be 120 over 80. But if that person's blood pressure normally as a standard or baseline is always 110 over 70 or 110 over 80, then having 120 for that person is already high. Is different from someone who has always been having 140 and then today has 130. So to them, like, this is a win. For me, I've always had 140 over 85, and today I checked it and it's 130 over 80. That's a win. But generally speaking, that's actually elevated blood pressure. So what I'm trying to say is you need to have a baseline. You need to have a base for what your blood pressure is, and then follow up at least for the first time you're checking. Have 2 or 3 follow-up checks, maybe a month different. Within a month, just do 2 or 3, and then you have an idea of what to expect. The best time to check blood pressure is in the morning before your activities begin. So when you check your blood pressure, take a note of that, okay? And then you begin to work on all those modifications, lifestyle modifications especially. That very interesting fact is some people don't realize that the amount of water you're taking plays a big role in controlling your blood pressure. So it's very important to stay hydrated. Always take water. Never play with water. In fact, water is the first thing to every condition. Water is your first bet. So that is step 1, checking your blood pressure. Step 2 is doing further tests, which involves blood tests. Now, I will not go into all the details about blood tests, but I'm just focusing on just general information that you need to know. But they will check the kidney function, they'll check your heart function, and sometimes even have to go all the way to the liver. So it's important that there is a balance between all of the functions of these organs, because they play a vital role in controlling your blood pressure. An example of a kidney function test is electrolyte, urea, creatinine. So it's important to say that, okay, this kidney is functioning well, this kidney is in trouble. Okay, some people, due to high blood pressure, begin to have problems with their eyes. Yes, because there are small vessels within the eyes, within the retina, and once pressure begins to build up, it begins to have problems, and they begin to have vision problems. So it's also good that an ophthalmologist gets to see such people. So the first thing is actually to screen the general public. Who are those who are at risk of developing high blood pressure? What should they do? So like I explained about those who are at risk, those people who are diabetic, those people who have maybe a family history of hypertension, those people who take alcohol for a long period of time, those people who smoke, those people who are obese, that whole group, you already know that sadly you fall in the risk category. So it's important to follow through by doing a full body check. Do a full body check. They'll check your blood pressure, check everything else to be sure that everything looks good. Then work on maintaining a healthy lifestyle so that you do not fall into having hypertension. One of the major challenges about managing high blood pressure or hypertension is medication. Now, this kind of medication are not medication that you take like antibiotics, where it's like a week or 2 weeks. No, it actually takes a long period of time. Depending on the gravity of the damage, depending on how much or how high, how sustained your blood pressure has remained, and depending on how well your circulatory system, your whole body is able to adapt to the changes, okay? It determines how long you get to take the medication. It also determines the amount of medication you need to take. Sometimes some people depend on 1, some people would need 2, some people 3, some people even all the way up to 4. Of course, those ones are more complex issues. But like I said, it is quite a long road trying to treat hypertension. So prevention is always better than cure in this case. But for those who already are hypertensive, I know there's some people who struggle with taking the tablets, keeping to, every day you're taking a medication and all of that. With time, it becomes a problem maintaining it. But you are advised to please stick to your medications. Another problem is some people get lost to follow up. So you were placed on the medication and you've been on it for maybe 6 months, 7 months. You haven't seen your cardiologist again. You haven't even seen your doctor again. You keep buying the same medication. Yes, you may think you are helping yourself, but in the long run, not really, because you need to monitor your system. There are some people who do well on one medication, one drug, while some people will need a second drug. Some people will need a third drug. So that's why you need to follow up with your physician. You need to follow up with your cardiologist. You need to follow up with the person who is monitoring you so that they can monitor your progress and help you to manage the medications you're taking. Some people over time, they go somewhere and maybe they take two readings and they find it's normal, so they're like, okay, I'm good, I can stop taking the medication. Actually, that's not good. So when you skip medications, maybe you take one, then the next time you take like 2 weeks, another one you take only when I feel headache, that's when I take the blood pressure medication. That also is not good. It's like always waiting till you have a fire to put out the fire. So it's not going to be good. It's very bad for your system, it's bad for your brain, it's bad for your kidneys especially. So it's very important that once you're placed on any medication, stick to it. Stick to the prescription, stick to the plan, and always go for your follow-ups. And whatever prescription you were given, please stick to that one. Because if one medication works for your brother, it doesn't mean it's going to work for you. You have a different cause, you have a different progress. So it's always good that you stick to what was given to you. What works for person A may not work for person B. Okay, now I had to take some time to dwell on medication as management for hypertension, and that's because that has been a major problem regarding the management of hypertension. But I must say something, and that is very, very important to managing hypertension, and I want you to listen very closely. The treatment for hypertension is not majorly medication. In fact, medication is the last on the list of things to do once a person is diagnosed hypertensive. Why am I saying that? Because, like I said, the body has a compensatory mechanism trying to balance blood pressure whenever there's a problem. And when it's become sustained, the first thing you need to do is take away the thing that is sustaining that high blood pressure. Makes sense, right? Yes. So the first, diet, exercise, rest, reduction of stress, avoiding alcohol, stop being in one position all the time, get active with your life. Allow yourself to de-stress. Have moments where especially emotional stress. We are in a society now where everyone would say, I have one form of stress or the other. It is very important that you have a place to detox. Exactly. You need to detoxify your blood, detoxify your soul, your emotions. All of that are important. Have a few laughs a day. Have a laugh. Don't go through the entire week and you've never laughed. It's not good. It's not good for your system. Don't go through the entire week and you've not had a time to, go out and just go for a walk in the evening, enjoy fresh air. Some people are always inside their house under the AC, under the fan, and they feel, I'm good, Yes, it may work for you, but it's not really good. It's not advisable. It's very good to go out and have fresh air. It's not just oxygen you're breathing in. There are a lot of other therapeutic advantages of going for walks in the evening. So I advise you to please go for walks. Take enough water. Water cannot be overemphasized. Yes, start your day with a cup of water. Now some people say it's cold water, it's hot water. I just say take water that you normally take every day, right? It's not a problem. Room temperature water, start with a cup in the morning. Before your breakfast, have another cup. After you've eaten sometime in the late hours of the morning, have another cup. And they would say you need to take 2 liters or 3 liters in a day. I don't like to generalize it because everybody's system is different. So it has to be balanced based on individual basis. Just work at having adequate amount of water every day. Don't go less than 2 liters, right? That's just on an average, right? Target that. If you can do more, fine and good. But don't be having like 1 liter on a very hot day. You're going to lose a lot of water, from sweating and all of that. So please do your best. Stay hydrated. For diet, go for natural things. Go for natural food stuff. Don't be tricked by the trend where everything is fast food now. So yeah, fast, I need to have this fast, I don't have time to be able to cook, I don't have time to do this, to do that. But yeah, what is better for you to have a sustainably healthy life? or to go fast all the way and get sick and spend all the money you're trying to make on your health. I feel it's better to have a balance. Go for natural foods. I always advise people when it comes to deciding what your menu, what your food menu should look like. Reduce carbs doesn't mean eliminate it, because you still need them. So reduce the amount of carbs you're having, increase the amount of vegetables you're having, increase the amount of protein you're having, reduce the amount of salt you're using in your food. It's not about the amount of salt that's actually applied or used in the cooking. It's actually the amount of salt that is added after the food has been cooked. That's really bad. It's also important for you to have times to exercise. Now, some people would say, I walk from home to my workplace, to my job every day. Yeah, that's good, but that's not enough, right? Your walking is just your feet that are engaged. You're not like swinging your arms and breathing in and sweating on your way to work. But that's part of the activity and why an exercise is important. So it's good for you to take your walks, very good, but I feel and I advise you that don't let that substitute exercise. Exercise, you need exercise. If you can plan it 2 times, 3 times a week based on your schedule, that's a good one. You can skip. Dancing is a form of exercise. Yes, there are a lot of dance videos on YouTube that can help you. You can do it in your house if you don't have time to apply to a gym, and all of this would be very important. Now, one part I would like to dwell a little bit on is about obesity and weight control. Now, I've had a lot of patients complain, struggle, they've tried this routine, they've tried that routine, and it's not working for them. I'll just generalize this, okay? There are people who are having a BMI of over, even up to 40. Those people, you wouldn't expect them to say, yeah, just do exercise and you'll be fine. That's not enough. It has to be a combination. They need to see a specialist. They need to see an endocrinologist. They need to see a nutrition specialist and have a holistic platform or holistic approach to managing their weight. Don't be discouraged if you're doing something, you just got on a new diet or a new exercise plan, trying to lose weight, and you checked yourself in after a month and it's like you haven't lost anything. Don't be discouraged. Sometimes it takes time. There are different types of body types, okay? So there is the mesomorph, there's ectomorph, there's endomorph. If you are endomorph, it means you gain weight very easily and you lose it. It takes a lot to lose weight for those people who are endomorphs. So you need to know your body type first before you get on any weight loss plan. Okay, so know your body type. Then the next thing is to know the kind of diet you're having, how many times you eat. There are some people who think eating once a day or twice a day would help them lose weight. That's not the plan. If your body type is, let's say, mesomorph, for example, eating once a day, eating twice a day, that works for you. But if you're endomorph, even if you eat once a day, it doesn't really have that effect, because it's not just about what you're eating, because you have a slow metabolism. It's about what kind of food you're eating, the times you're eating, and how your body stores fat. So all of this is a combination. When you're getting on a weight loss plan, please don't just go to one area and focus on that and feel discouraged when it doesn't work. You can lose weight. It has to do with your diet. Even the state of your mind plays a very big role in your weight loss journey. So your diet, your emotions, your mental state, your exercise, your mobility, the kind of work you do, your stress levels, they all play a major role in your weight journey. As I conclude, I just want to run through and summarize. Hypertension is a major problem in our society today. It's affecting not just the elderly, but even the youth. And this calls for quick action. Anyone can develop hypertension because of the levels of stress we're having, because of the type of diet we're eating, because of the sedentary lifestyle a lot of people have been forced into, because of not having exercise, because of intake and ingestion of alcohol, smoking, and all other processed foods that do not digest well in our systems, and the genetic factor being passed from a parent to an offspring, and all other factors. All these increase the risk of developing high blood pressure and hypertension. Now, when someone is already in that risk group, is very important to pay attention to everything that can increase that tendency of developing hypertension. So please go for your regular health checks, speak to a physician, ask questions, find out more about how your body is doing so that you know the things you need to adjust and things you need to start doing. You need to be able to have that mental space that's very accommodating. You need to have that space that allows you to relax. You need to have a place where you detoxify your system. It's very important for you to stay hydrated. It's very important for you to have the right kind of people around you that encourage you, that inspire you. And it is important for you to follow up with your medication if you're hypertensive. It's important for you to follow up with your lifestyle modifications if you're hypertensive. Don't be quick to taking a medication, because once you start, it's a long journey for you to get into the point where, if any time, that you would have to stop that medication. Thank you very much for listening. My name is Dr. Shalom, and that will be it from me from now.
Now we've come to the end of the video. Thank you for staying till this time. You are the real MVP. I love you. Thank you for the love so far. And special thanks to our guest, Dr. Shalom. Dr. Shalom, you are just the best. Thank you. God bless you. I really appreciate you. Thank you. You took out time out of your busy schedule to help us do this, to help us educate people. I am really grateful. Thank you very much, sir. God bless you. So guys, see you next time on my next video, where we'll be dropping something hot and spicy. You know how we do it. So see you guys. Bye. Bye. Merry Christmas.